Here we go. Good afternoon, everyone. First, I want to thank and commend all of the people on the planning and prevention team, as well as frontline workers who have been working nonstop to keep us safe since this pandemic started. It has truly been an honor to witness firsthand the best that Manitoba has to offer, working together to keep us safe. I also want to personally thank Dr. Reimer and Johanna Bota and the entire team for the comprehensive and detailed plan that has been compiled during these unprecedented times. As all of you can appreciate, there is no step-by-step playbook to follow. But through their efforts and examining different options and approaches from around the world and across Canada, this team has put together the most wide-ranging plan possible, recognizing that some elements such as vaccine supply are out of our control. I also want to reinforce that we are trying to provide as much information as possible as soon as we receive it. As all of you can appreciate, this is the largest rollout of a vaccine in the history of not just Manitoba, but the entire world. And we are all trying to plan for every conceivable scenario and adjust the plan accordingly. Maybe we have been a little too cautious in getting out information, but when situations are changing day by day, and in the case of vaccine supplies, sometimes hour by hour, we wanted to make sure we had all the questions answered before releasing the information. I realize now that we can't wait for perfection. So we will provide as much information as possible as soon as we can, recognizing, of course, that things will change. So without further comments, I now want to thank Dr. Reimer and her colleagues for their expertise, professionalism, and incredible commitment to putting Manitobans' health first and foremost. So now I will turn it over to Dr. Reimer.
Thank you so much, Minister. Good afternoon. Today I am pleased to update you on our plans to immunize every Manitoban following a comprehensive prioritization plan. So I'm going to be running through some slides, and a complete version of this will be available on the vaccine website. We can give you a broad vaccine update overall, and then after that we can take questions. So if we turn to the first slide. So this, just for a bit of context, these numbers are changing daily, but I wanted to show Manitobans where we sit when it comes to fully protecting people against COVID-19 with 2 doses of the vaccine. Right now, we are 3rd in the country in people being fully immunized with 2 doses. This is our plan. In fact, every injection at a super site this week is a 2nd dose. So we expect to see this figure only improve over time. As you all know, right now we have a very limited supply of vaccine. But assuming supply issues resolve, and we start to see larger shipments of Pfizer, Moderna, or any other vaccine that's currently in development, we understand that Manitobans will want to know who's next and when it might be their turn. So turn to the next slide. So this is a broad overview of what guides our decision making. The National Advisory Committee on Immunization sets broad guidelines overall for the country as a whole. We then take those guidelines, those recommendations, and we assess what they mean for Manitoba. We rely on expert guidance of Manitoba's Vaccine Medical Advisory Table, which includes 27 doctors, myself included, a pharmacist, several nurses. We work with that team as well as our medical officers of health, our public health nurses, and our epidemiologists to look at the situation in Manitoba and make decisions based on the local situation as well as the guidance from the National Advisory Committee. Once those decisions are made, our planning team then helps us align eligible Manitobans with the available supply of vaccine so they can be immunized. Next slide, please. So this slide shows us where we are now, within what we call stage 1 of the NACI approach. So NACI suggested that we look at congregate living settings, specifically those for the elderly, healthcare workers, Indigenous people, and older adults more generally. So these are the same as the initial groups that we announced in December. We've made progress here, but we still have more people to immunize within this stage. Next slide. So this is stage 2 as recommended by NACI, and this is where we will be going next as vaccine becomes more available. Based on the current projections, we don't think that we can begin this until April, but of course that may change as numbers change related to supply. So this includes all remaining healthcare workers, all congregate settings that we haven't reached yet, and NACI also refers to essential workers. I just want to point out before we leave this slide that NACI doesn't define exactly who an essential worker is, and this is something that each jurisdiction needs to assess on their own. Next slide, please. And so all of that takes us to Manitoba's plan. How do we reconcile NACI's guidance, what we know about our local epidemiology, who is at risk, who should be immunized as quickly as possible? We have arranged our approach into 4 broad categories. Each is broken out into 4 stages so that we can clearly see how we're going to move through this prioritization. Again, the groups listed in stage 1 are fairly familiar. This is where we began when the first doses arrived, and we expanded as supplies became available. We distributed initial doses to our First Nations partners, and we began immunizing personal care home residents. So stage 1 is well underway, and in fact, we've covered almost every group in our stage 1 so far. In stage 2, we're bringing in more healthcare workers. In some cases, we're still using age criteria, and in others, we will be including healthcare workers of all ages. We will be expanding into congregate living groups as well. So next week, once our focused immunization teams have completed the personal care homes, they will be moving on to other congregate living settings, such as long-stay hospital patients and supportive housing facilities. Going forward, these same teams will also be addressing other congregate living settings, such as shelters, transitional housing, correctional facilities, and others. We will continue to make doses of vaccine available to our First Nations partners so that they can fulfill their priorities for immunization. This is also when we expect to begin immunizing Manitobans, beginning with our oldest citizens, recognizing that they are often at greatest risk of severe outcomes. And as you can see, the further progression and expansion of criteria, building on those same categories in stage 3 and 4. So as we've said, there will be a vaccine for everyone who wants it in Manitoba. But depending on your situation, you may need to be patient. I also want to note that we are continuing to look at essential workers and how we build them into our prioritization plan. This is something that we will look at as new vaccines are approved in Canada when supplies are greater and more predictable. Very soon, we will also be making an online calculator available so Manitobans can see themselves in these projections. Next slide, please. Looking forward, we know that there are more types of vaccines on the horizon. In fact, Canada has agreements on 7 different vaccines, not just the 2 that we're using now. So you may have been hearing about AstraZeneca, as that one appears to be the closest to being ready. So if it's approved, this would open up another avenue of vaccine delivery that we have been planning for, but can't implement with the vaccines currently available to us. So we've spoken about that in our press conferences before, the fact that the mRNA vaccines need to be stored in cold or ultra cold temperatures and are very challenged as far as how they can be transported as well. The newer vaccines can be safely stored in doctors' offices and in pharmacies in the fridge, not necessarily in freezers like we see with the existing vaccines. So we are already working with these partners to plan for what this will look like and what else we need to have in place to make it successful. And we will have more news to share on this in the coming days. But this could be the way that we deliver hundreds of thousands of doses, and that is significant. Next slide. So the next 2 slides are showing different scenarios as to how we might expect to move through the immunization campaign in the coming months. The first is based on the vaccines that are approved right now and the supply projections that have been provided to Manitoba so far. We are also assuming that we're immunizing 70% of Manitoba adults by the end of December. In the second slide, we're looking at a higher supply scenario. So this one includes those vaccines that are currently being reviewed but have not yet been approved for use in Canada. If they are approved, we're estimating that another 700,000 doses will be delivered to Manitoba, and so we will be able to immunize the same people, 70% of Manitoba's adults, by the end of August. So that's the end of the presentation, but I do want to also cover some of our usual vaccine updates for Manitobans. So to date, 33,361 doses of vaccine have been administered. This includes 23,187 first doses and 5,087 second doses. We are on track to complete all first doses for personal care home residents this week, and I expect to have more detailed information to share on this soon. However, what I can tell you is that by the end of the day Monday, more than 5,200 residents had been immunized. There is still a small number of appointments available in Thompson next week, and eligible workers can call to make an appointment. Our team is also working very hard to reduce the impact of the continued delay of the Pfizer vaccine. But right now we're still waiting for more information from the federal government. We expect to have answers for Manitobans about what we're going to do next on Friday. This will help us determine how many appointments may have to be rescheduled. For now, if you have an appointment, please do keep it, and keep your eye on the bulletins on the website and on my Twitter feed as well, where we'll let you know if that changes. I'm committed to provide weekly updates on adverse events following immunization so that I can provide a bit more context and some medical information as much as I can on these. To date, there have been 18 adverse events following immunization in Manitoba. Based on the number of doses administered in Manitoba, this is well within the normal range for immunization, and it's consistent with what we're seeing throughout Canada. These are being investigated by public health right now, and as more information is available, we will share it. I do have a short update on recruitment as well. Right now, I can tell you that 1,115 people have been hired to assist with Manitoba's vaccination efforts at the sites in Winnipeg, in Prairie Mountain, Interlake Eastern, and in the Northern Health regions. This is in addition to 892 staff who have been assigned to COVID-19 immunization efforts from regional health authorities, bringing the total of new hires and existing staff to 2,007. And I'd like to hand it back to the Minister for further comments.
Thank you very much, Dr. Reimer, and thank you to you and your team for the incredible work that you're doing to ensure that we get as many vaccines out to Manitobans as we can in a priority way. So thank you for that. I know everyone obviously is anxious to know where they fall on the priority list. Much depends, of course, on the vaccine supply from the federal government. And as Dr. Reimer said, we will hopefully be getting more information on that front on Friday. We also know that there will be questions on the priority list, but please know that experts in healthcare are the people that compiled the list based on research and science in consultation with their counterparts across the country. So again, I want to thank them for the incredible work that they've done so that we can put this list out to the public today. So thank you, and now we're ready for any questions that you may have.
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Brandon Sun, Michelle.
Good afternoon. My first question is for Minister Stefanson. I'm wondering how conversations are going with the Manitoba Métis Federation. Will Métis soon be enjoying a similar relationship with the government as First Nations have regarding data sharing and the opportunity for a meaningful planning voice in the vaccine rollout to its vulnerable populations?
Yeah, thanks very much for that question, Michelle. I appreciate it. I did have the opportunity actually last week to meet with Minister Chartrand. I think we had a very productive discussion, and I know that our officials are having discussions behind the scenes to see, where, we can work together in a collaborative approach. So that's very important to me. That was very important to us at that meeting, and we're certainly committed to working with the Manitoba Métis Federation on this front.
Thank you. My second question is for Dr. Reimer. I'm wondering if you can paint a couple of vivid pictures, one of which would be for a basic resident of the Prairie Mountain Health Region, let's say 45 to 55 years of age, not an essential worker, not a healthcare worker, when vaccine is flowing. Can you sort of describe what it would be like to get vaccinated for that person? And similarly, can you paint a picture of vaccine distribution for elderly rural people who aren't within a reasonable driving distance from one of the super sites?
You know, we're really excited to be able to release these prioritization lists, and we're very dependent on the supply that comes through the federal government to be able to get those vaccines to Manitobans. But I know that Manitobans are anxious to be eligible. You know, I've spoken to my own grandma who's 93 and living in an assisted living facility, and she can't wait to be eligible. So I'm excited that she gets to see this list today. And so, you know, throughout Manitoba, we want to reach everyone. That's our goal, that all Manitobans have access, whether you live in the cities, whether you live in a remote setting. We're going to be working hard to have sites available that any Manitoban can access within reasonable distance from their home, in a space that is safe and comfortable for them. So this is something that we are actively working on. We're going to be rolling out new super centers, for example, in the remaining 2 regional health authorities. That's being worked on right now. But we're mostly just trying our very hardest to get every vaccine out as quickly as we possibly can, so that, you know, as you were mentioning, the 50-year-old who's living in Brandon or the elderly person who lives in the country, they can see where they are in the list, and they know where they can get that vaccine as soon as we have it available.
Thank you.
From the Winnipeg Sun, Scott.
Hi, good afternoon to both of you. Scott Billis, Winnipeg Sun. Dr. Reimer, and you spoke a little bit about the essential workers list during the technical briefing. I'm just wondering, you know, the province has essentially had an essential workers list, you know, for the majority of this pandemic, just based on what was allowed to open, truck drivers, teachers, that sort of thing. You know, why wouldn't that list be used as, I suppose, a separate category to get, you know, those people who are working in, you know, either higher risk jobs or public facing jobs all the time, to get them inoculated, you know, to reduce that risk for them?
There are so many Manitobans who are essential to, you know, the lives that we all live in the province. And I would love to be able to offer to every Manitoban the opportunity to get vaccinated today. What we're doing is we're basing our decisions on the science that we have in front of us. So when we looked at the research, it was very clear that an age-based approach was going to be the best way that we can prevent those serious outcomes, the severe health outcomes that people are experiencing related to COVID. So we are going to continue to look at things like essential workers going forward, but we wanted to ensure that we had those highest risk folks getting access first, and using the science that we have in front of us to make those decisions.
Thanks for that. And again, you touched on it, but, you know, so, you know, the people listening on can hear. In terms of immunocompromised folks, it seems, at least right now, that they will just fall into the general population when it comes to inoculation. They're obviously at a higher risk. I don't know how many fall into that category in terms of population, but again, why wouldn't, you know, it make more sense to ensure that they would be more of a priority than, let's say, you know, people in their 30s or 20s when it comes to vaccinations?
So there are many health conditions that can put people at a higher risk of severe outcomes related to COVID, and everybody's health is unique to them. And what we did is we looked at the research that was available, and there are studies that have been done that analyzed what approach captures the best picture of the people with severe outcomes. And they very clearly showed us that when you do an age-based approach, not only do you capture people based on their age alone, but you capture most of the people with those health conditions that lead to the severe outcomes as well. So we want to start with that age-based approach and continue down following the science down to when the time that we can tell all Manitobans that they're eligible.
From CBC Manitoba, Bart.
Dr. Reimer here, just not to you, it's Bartley here, forgive me. A little bit of a clarification. You said in this presentation and in the earlier one that phase 2 would start in April, but the charts you presented for the low supply scenario show congregate settings beginning in February and seniors starting in March. what's more accurate, that chart or what you just said about April?
Yeah, the charts are our best estimates. We are looking at the numbers every day, and they're changing every day. So what we're told right now, if we get all the doses that had been previously allotted to Manitoba, we could probably open up to Manitobans, our elderly Manitobans, in March at some point. But we know that we're dependent on what supply we get from Pfizer, from Moderna, and so certainly those things could change. One of the things that we're also doing with our focused immunization teams is we're going to those congregate living settings. So we are right now using those teams to reach out to all of the personal care homes. But once we've completed the personal care homes, we want those teams to stay active and to be reaching the high risk settings as quickly as possible. So some of those highest risk congregate settings, we will be sending teams to in February.
Thank you for that. That does explain it. I appreciate it. Minister, this is your first presence at one of these briefings. I just want to ask you, in general, how you feel about Manitobans' let me rephrase that. Given the problems Manitobans have had in the past, in September with the testing and in October with the contact tracing, why should Manitobans be confident that Manitoba will get the vaccination program right?
Well, thanks for that, Bart. I think a very good question, and certainly I think we've got an incredible team of experts in the vaccine task force who have put this together, and I just again want to thank them for the incredible work that they've done. And Manitobans can be confident in this team. I've met many of them. I've been on various Zoom calls or Teams calls with them, and had the opportunity to meet the incredible experts across this vaccination team. So I rest assured to Manitobans that we're in very, very good hands with this team.
From the Canadian Press, Steve.
Dr. Reimer, I just want to follow up on something that was asked earlier. The age-based approach, you said it does capture most of the underlying conditions, but there are people with underlying conditions who are middle-aged or younger. And I'm wondering, is the age-based approach set in stone, or as time develops and supplies might increase or decrease, would you be looking at possibly making an adjustment to capture people in high-risk groups who are younger?
Yeah, so there's no approach that's going to capture Manitobans in a perfect order about their risks of having severe outcomes. But what we've done is we've looked at the research studies that exist, and they've consistently shown that the age-based approach captures the best proportion. So it's certainly not going to be perfect for every individual in Manitoba, but it does show us that that is the way that we can capture the most high-risk people in the right order. But I would say that nothing is set in stone. As science evolves, as we learn more about these vaccine rollouts, we will be looking at that regularly. We'll be meeting with our medical advisory team, and we are always open to changing things as information comes. You know, this is a global pandemic, and the whole world is learning together about what to expect from these vaccines. And so we want to be ready to learn from our colleagues in other provinces, in other countries, and apply those learnings in Manitoba.
And for Manitobans who might be looking at the chart concerning the general population and the age breakdown, how soon do you see Manitoba getting to the point where people over 60, for example, in stage 3, might get vaccinated?
You know, a lot of that is really estimates right now. So we're certainly hopeful that based on what we're hearing from the federal government and the manufacturers, that people over 60 would be able to be included in April, May time period. That's our best estimate today. Certainly if supplies increase, you know, we could be talking more earlier into April. If supplies continue to be strained as they are right now, then it might be later on and into early summer. But you know, I'm remaining optimistic that we're going to be getting increases in vaccines substantially in March, and we'll be able to open up to Manitobans over 80, hopefully in March. and then just moving down from there.
From CTV Winnipeg, Michelle.
Hi, Dr. Reimer. I'm wondering a little bit more about the essential workers. Manitoba is kind of still working on who or which professions would be included. Is this going to be like a separate list that comes out, or will it be added to the plan? And do you have a time frame for that?
So I would say that no decisions have been made about whether or not essential workers will be included, nor if they are, which categories of workers would be included. You know, we have some time before we have enough vaccine available to open up to groups like that, and we want to use that time to make some informed decisions where we can look at the evolving science, we can look at the local epidemiology, we can talk to some of our key stakeholders, and make those decisions in the coming months.
Okay, I'm also curious about, once we get to the general population, how will people be making appointments? Like, have you kind of decided what would be the best way? Because right now, the government is providing the contact information to call centers. How will that change once we get to that general population?
Yeah, I don't have the exact communication rollout plan in front of me. Certainly we'll continue to use our call center. We're also planning to have an online booking system available. But as far as exactly how that will all be communicated, I'll have to take that away and ask for our communications team to provide that to you.
From City News, Stephanie.
Hi there. I was just wondering if you could clarify what the moderate and high-risk people in congregate settings might be in stage 2 there. Can you give some examples of what those settings are?
Sure. We actually looked at 4 different factors when determining which settings were highest risk. We looked at the age of the individuals who live in that facility. We looked at their health or cognitive status, how much assistance they require on a day-to-day basis. We looked at the structure or setup of the facility and how easy it is to follow public health guidelines in the facility. For example, are people in shared bedrooms, shared kitchens, or are they able to separate easily? And finally, we're looking at the income of the residents there as well. So using those 4 factors, we have created a calculation system that weights each congregate living facility in Manitoba on those different categories, and we're going to be coming up with a full list of every facility in Manitoba according to their risks in those 4 categories. We're going to be starting the week of February 1st with the highest risk groups, which so far those facilities that have come out as the highest risk are long-term stay patients in hospitals and some of our supportive housing facilities.
And then can you just tell me if healthcare students, like nursing students, are also in the categories of healthcare workers?
So we generally define healthcare workers as anyone who's working in the healthcare setting. So if there are nursing students doing their practicum on the ward and are there every day treating patients and are providing care to people with COVID, they would be under the same eligibility as the rest of the staff who's in that environment. If we're talking about students who are still in the classroom and are not part of the care team, then they would be included with the general population.
From CHVN, Taylor.
Hi, good afternoon. Again, because this list that came out is age-based, how are you balancing the potential to spread the virus with outcomes? Most elderly people stay home, whereas younger people are at work, they're in the community, grocery shopping, those kinds of things.
We actually had some very difficult discussions about that because we do know that the younger populations are more likely to be out and about, to be social, to be at events once we can have events. At the end of the day, it came down to looking at who was the most vulnerable and who was going to be experiencing those most severe outcomes. And we wanted to provide them with the first access so that they were kept as safe as we possibly could keep them.
And we're seeing in other parts people winning a bit of a vaccine lottery by hanging around vaccination sites and getting extras. Now, how is the province preparing for these kinds of scenarios, especially since an increase in vaccine volumes could lead to more missed appointments?
So I'm not familiar with the people hanging around the site necessarily, but we do have very clear protocols in place for our staff as to how many of those vaccines that they prepare ahead of time. So for example, if we're talking about Pfizer, we generally get about 6 doses from a vial, and we ask all of the immunizers in the supercenter to only use 1 vial at a time so that they wouldn't have a lot of vaccines sitting there at the end of the day, even if people cancel their appointment. We can keep them frozen until we need them, and then keep them in the fridge for 5 days as well. So that's been something that we've worked very clearly to produce protocols that our immunizers follow to ensure that regardless of how many people miss their appointment that day, that we would never have more than the 5 out of the 6 doses in that last vial left at the end of the day.
From the Winnipeg Free Press, Larry.
Mr. Stefanson, what message does it send when the head of a healthcare board of directors ignores the advice of federal and provincial leaders and chooses to travel out of the country during the pandemic?
Yeah, thanks for that, Larry. And I know that Dr. Roussin and Dr. Atwal, as well as the Premier, have been very clear that now is not the time for non-essential travel, and we would expect that those individuals to follow the law and follow the public health orders. So when they come home, they will properly isolate according to those orders.
Are you disappointed that Mr. McWhorter has chosen to work from Arizona, and is your government considering rescinding his appointment on the WRHA board?
At this time, we are not looking to rescind his appointment, no. Obviously, the Premier again and Drs. Roussin and Atwal have been clear that now is not the time for non-essential travel, and we do expect that that Manitobans returning home will follow the proper isolation orders.
Our final reporter this afternoon from Global News, Marnie.
Hi, good afternoon to you both. I just, on the phases we have paramedics included, I'm just wondering why not other emergency workers like police and firefighters? Where do they fit into this?
So paramedics play a pivotal role in our healthcare system. They're involved in direct care, sometimes intubating people in the field, for example, where they're exposed to airways at a very close proximity. They've also been providing care in some of our personal care homes. They provide service in some of our shelters. They're the primary care providers for some of our shelter residents. So the paramedics, because they provide that essential part of our acute care system, were important for us to include in the rollout along with the acute care system overall.
And I just want to go back to another question that was in the technical briefing. Obviously, these plans only go down to the age of 18. Lots of vaccines are only approved for that age. Can you just tell people why children aren't included and when they could possibly be included in this?
Yeah, so right now we're limited by what the vaccines are approved for. The Moderna vaccine is only approved for people over 18, and Pfizer is only approved for people over 16. And so for the time being, we're making plans based on the vaccines that we have available. Certainly, if that changes, if the manufacturers change their guidelines, or if new vaccines become available that have different age categories, we will look at that and we will analyze the risks for that group specifically and make decisions about where they best fit in the prioritization of Manitobans.
Thanks, everyone, and this concludes today's media briefing.
Thanks, everyone.